This is the Beyond the Prophy podcast, the podcast that empowers you and inspires you to seek career excellence while pursuing your passion. And I'm your host, Shavonne Healy. Welcome to the Beyond the Prophy podcast, where we focus on helping our listeners find career satisfaction. I have a special guest with me this evening who I have admired and have been inspired by watching her journey. And I love having time to speak with her and to learn about what she does, because she's looking at improving career satisfaction on the clinical side of hygiene. You hear of groups like Trapped in the Op, and you hear of so many other hygienists out there who are trying to make a career for themselves outside of the op. But we were trained to be prevention specialists, and I love how this particular guest has taken her role as a hygienist very seriously and has expanded the role. So I would like to welcome Shavonne Healy onto the podcast.
Hello, everybody. Thank you for calling me special. You know what song came into my mind when you said that?
So special, so special, so special. That's how you know you like reggae.
So special, so special, so special, so special. I'm going to play that song after you leave. Dance around my apartment. Thank you.
Yeah, I'm very happy that we finally have the chance. This is like, took forever for us to have to do this.
Yeah. Although there have been many conversations, phone calls, video chats that we've had that could have definitely been like a podcast episode.
Yeah, absolutely. Absolutely. We just had a deep conversation over 2 martinis and 2 margaritas.
Don't tell everybody my business.
Okay.
I don't drink. I'm under 21. People don't need to know that about me. Actually, Jasmine was drinking the martinis and I had the water. I was the responsible one.
Yeah.
Lies. Okay. I like mint mojitos.
You know who has the best mojitos? There's this salsa place somewhere in D.C., Havana Village, that puts sugarcane in their mojitos. It is so good.
I've never heard of Havana Village around here. You can
drink it, live salsa music. So you can eat in the restaurant, and like the second and third floor is live music. There's a live band or a DJ. And they have the best mojitos I've ever had in my life because they put sugarcane in there.
I'm going to have to Google this place. I've lived in D.C. for almost 10 years.
It's in Adams Morgan.
What's the name of it?
Havana Village.
Okay.
It's like a Cuban place.
Because there is a Cuban spot in Adams Morgan that I go to that has great mojitos and a live salsa band, but they don't have three floors.
It's not 3 floors, huh?
No,
I wonder if it's the same place, because I've only been there once, and it was one time.
But we don't drink, though. Why are we talking about this?
I know, exactly.
We're not trying to promote alcohol.
Exactly. All right, so I met Miss Healy.
No, don't call me that, please. I feel like I'm 100 years old when people call me Miss Healy.
I met Shavonne 2 years ago at an ADHA annual conference. We were in a focus group. Mm-hmm. And I noticed her because of the response that she gave and some of the questions that were given. She was very empowered and inspired. Wound up being in a class a second time together, and I was like, I want to introduce myself to this woman.
Stalking me.
She was stalking me.
We were stalking each other.
I was there first.
Yeah, I also wanted to speak to you as well.
Oh, really? Well, that's why you gave me your information. And then we wind up going to UYP together, Unleashing Your Potential. And we've just watched our journey over this time. But what I really like about Shavonne is she is a fire woman, as my friend Christy says, because what she's doing in creating this role for dental hygiene in oral surgery is just so unheard of. I don't even know what she's talking about. So that's why we have her here to talk about that. So why do you think hygienists should be in oral surgery? Because most hygienists, like when you think about hygiene, most of them are tired of the 9 to 5 or 8 to 5 regular clinical hygiene. They don't feel like they're being used to their full potential. So why would there be even a need for hygienists in oral surgery?
Well, the role of the implant care practitioner, it's not about the dental hygienist. It's about this new population of underserved patients, which are the patients with not just complex implant dentistry, but just implant dentistry as a whole. So it is a career path that I do will benefit hygienists in one way, because it really when I was in oral surgery, even though obviously, our scope of practice doesn't allow us to practice independently, but I was practice independently because the surgeon, he didn't bother me, and he wanted somebody to come in there as a professional and take control and all this and that, and I was able to do that. But what inspired me to move forward with this mission was because I really felt like, now, when I was in oral surgery, obviously oral surgeons work on a referral basis. So I was in a complete unique situation where I was truly practicing individualized care. And depending on the patient situation, I would spend anywhere from 60 minutes to 90 minutes with a patient. And upon my interviewing with the patient, I was realizing that these patients were coming to me from referral practices. So, for example, I would see a patient on Thursday, right? But on Monday, maybe they were with their hygienist in their periodontal office, and maybe the week before they were with their hygienist in their general practice, had absolutely no idea about how to care for their dental implants. So that's when I realized that the education was lacking in the dental profession, but I feel like there's an underserved population. They're not underserved because obviously they can afford implant dentistry, but they don't have access to competent care. So the implant care practitioner is a role that is advocating for this population of patients with implant dentistry.
Interesting. So, I realized I didn't know much when I was talking with Shavonne, and I was like, yeah, and the plastic instruments, they don't really, work and all this other stuff. And then she started breaking down some things to me that I didn't even realize really existed, because in dental hygiene school, and even when we're teaching in the curriculum, it's very basic. It's very, very basic. So one of the things that I appreciate about what she's doing along with her partner, Melissa Obraka, is they're trying to elevate our thinking, dental hygienist thinking with implants. So where would someone even start as far as understanding that, because we don't really have that much time within our clinical care to understand the fundamental basics?
Well, what I would like for hygiene students to understand is that your dental hygiene educators are not responsible. There's no way. You have 2 years, right? And what they're doing is they're teaching you the basics. But when you take your oath, right? We all take our oath at our candle ceremony, and we promise to advance, right? We promise to continue our education. So although it's true that the hygiene curriculum in schools, it's not there yet, but it is, because there are several universities that have implemented things like air polishing. For example, Phone School of Dental Hygiene has implemented it. Melissa Obraka had played a huge role in implementing air polishing at Burchard Community College, where she's an adjunct instructor. So it's happening, but it's not the responsibility of the educators to teach us all. We have to dedicate ourselves to continuing our education. So for clinicians who are interested in this role, you have to advance your education. You have to start going to outside of the box CEs. I was showing up at a lot of conferences where I was the only hygienist. And this is because I understand, I'm an expert in the maintenance area of implant dentistry, but the peri-implant diseases are so complicated, and implant dentistry has multiple components to it: surgical, restorative, and laboratory. And in order to understand implant care, you have to first understand the complication and where it came from. And surgical, restorative, and laboratory, I'm not going to learn about those in my hygiene conferences that I go to, because those are not areas that we quote unquote specialize in. So I had to start going outside the box and going to all of these different conferences where the expert clinicians that I was reading in all of my research were actually the people that I was stalking. Like I was stalking these people and just trying to understand really just the overall concept of, it's more than just maintenance. We have to take responsibility for our roles. This is not something that I feel as though every hygienist has to do, but I feel like if you are a clinician in private practice, you have to be able to recognize when somebody is outside of your needs. And that's why we have specialty. That's why we have pediatric offices. That's why we have ortho. That's why we have general. That's why we have perio, because dental hygienists there's no one hygiene practitioner who can treat all of these different populations, because it's specialized and you have to dedicate yourself to really learning from A to Z, how to care for this particular population that you serve. Did I even answer the question?
Yeah.
I think I'm in a whole nother boat here. But, I
appreciate it because I have a follow-up for you.
Okay.
Go ahead.
Because I get asked this question all the time. How do I become an implant care practitioner? Well, you have to start seeking advanced education, and you cannot put the blame on our hygiene educators. And I feel like that's what a lot of people are doing. Well, we don't learn this in hygiene school. Okay. But you have to, technology, research, everything is always changing.
Absolutely.
Technology in dentistry is changing faster than any of us can. I know I can't keep up with it. So it is, I was in a situation where I didn't even understand what was going on when I was in oral surgery. I can't even begin to tell you the kinds of things that I was seeing, but I will tell you that I didn't know what I was doing. So if I was going to serve this population, I needed to become an expert in what I was doing. So that's where my journey began, and it never stopped. I am an expert. I dove deep 5 years ago, and I never stopped. It just, every year it was getting more intense with everything that I was learning. But the thing that really sparked me advocating for the implant care practitioner was because, I think I have heard almost every speaker. And I would take what they would say and I would try to apply it to clinical practice. And it was almost impossible in a traditional setting when you're only given 60 minutes, because the standard of care and the different types of assessments, it's not the same for natural teeth. So we can't do it all in an hour. So somebody needs to take responsibility. Peri-implantitis is on the rise. Nobody's really to blame for that, but I think that there's one way to help. And our profession, we need to extend our maintenance teams in order to, let's just be supportive of each other. And really that's what the implant care practitioner is all about. If you don't have time to treat the patient with complex implant dentistry because you only have 30 minutes, first of all, you need to pull your dentist aside and have a conversation, okay? Because 30 minutes is just not enough time. But it is your responsibility to get that patient into the proper hands.
I really appreciate you bringing that up, because my next follow-up question was, one of the things that I admire about your journey and watching as you work with dentists is you're very, very empowered, and you will also advocate for your patient, but for yourself. And with a position like this, or you're trying to think outside of the box or think beyond the prophy when it comes to clinical care, traditionally you will not see a hygienist in an oral surgeon's office, but you have done it. So my question to you is the purpose of this is to introduce the listeners, but I do want to talk about some of the qualities that are necessary in order to think outside of the box or think beyond the prophy.
Okay.
So what qualities do you think a hygienist will need to either instill in themselves to prepare them for that next level of clinical care?
If they are interested in the path of the implant care practitioner?
Or whatever it may be.
Okay. Well, self-respect. First of all, you have to respect yourself. You have to have confidence and courage, and you have to be dedicated. See, I was in a conversation with a group of dental hygienists when I was like going, I was on level 100 when I was talking about teeth scrapers, because like I truly feel that people are going to act towards you or treat you a certain way if you allow it. So you have so many hygienists who complain in private practice about they don't have enough time, they don't have the equipment, this, that, and the other. Okay, well, what's complaining going to do for you? So first you have to advocate for yourself. And the person said to me, well, you know what, Shavonne, some people just want to do that. Some hygienists just want to do that. They just want to clean teeth. Well, you know what? That's not their choice, because this is healthcare. And first of all, we have a scope of practice that we have to acknowledge and respect and abide by. And we have a certain, protocols and standards that we have to follow. So it's not the hygiene practitioners. They don't have the decision just to be tooth scrapers, because these are people's lives that we're dealing with. We all know of the oral systemic link. It's a real deal. So I think that
see, you're a firm believer in there will never be tooth scrapers, where I feel like there will always be tooth scrapers.
There will always be teeth scrapers. And I'm not saying that it's not okay to be a tooth scraper. You are dealing with people's lives, and we have to honor the oral systemic link. Periodontal disease is a serious thing. Implantitis is a serious thing. People die from tooth infections. So it's not a choice to be a tooth scraper. We are in hygiene school. We are educated to be practitioners. We're educated to be healthcare providers, clinicians, and it's not a 9-to-5 job. It's not. But when I am an adjunct. I'm at Howard 2 days out of a month. Right now, they're not allowing me back until I finish my thesis, but which is a good thing. But when I meet the students, I ask them two things: who are you and why are you here? And for any of them who say I'm here because of a salary, I truly tell them that, well, you need to pack up your stuff right now and consider switching a major. Because hygienists, we do make good money, but we work hard and we risk our bodies. We risk our mental, physical, emotional well-being. So it's not a 9-to-5 job. You have to be able to really want to serve and take care of people. And it's not fair to the patients.
Do you think it's possible for a hygienist to be able to work clinical for the long term and be satisfied?
Absolutely. I'm very satisfied.
Because so many people don't feel that way. So what do you think the issue is? Why do you think
they're not advocating for themselves? They're not standing up for themselves. Why are they not satisfied? Because they're not being treated properly.
They also don't know who they are. I think that has to do with that.
I think
they don't know who they are, meaning they don't know their potential. They don't see their potential. They don't see that they have the ability to have the power to make the changes to make themselves happy. Instead, they stay because they're looking for someone else to bring them that happiness.
Well, there's that, and then there's the comfort zone that you address all the time on your Think Beyond the Prophy page, and in your podcast, you talk a lot about comfort zone. People are comfortable. They complain, but they don't want to step out their comfort zone because they have a fear of what can make them uncomfortable. So I think that's what it is. I mean, people use the excuse of, if you're in a situation where you're not being treated properly, they can't leave because, they have a mortgage to pay, they have kids to take care of, and I understand that. And I'm not saying that you should leave right then and there in that moment, but work on your plan. Start thinking of a plan. Your escape plan really is what it is.
And even then, like one of the things that I'm working on right now, my coach recommended that I create my guiding principles for my life. And those guiding principles not only will govern who I am, but it will govern everything else that I create through me. So my business would be governed by those, and the people, the staff that I bring into the business will follow those same principles if I set that up as something that's important for me, and setting those goals. So choosing your guiding principles and then choosing a strategic plan that you follow for that year will give you something really to live for, or I guess feel more accomplished and more satisfied with your career. I feel like for the most part, if you're doing the chat and polish 9 to 5, just clinical, go in and out, and that's it. That's where it leads people like, ugh.
Some hygienists do that, and they're very happy doing that.
Well, then there's a different, that's something different.
Mm-hmm. But regardless whether or not you are happy doing that, I'm advocating for the patients. Mm-hmm. My patients come first. Patients come first, the public, because these are not, a patient can be your mom, your dad, my sister, my nephew. I will always put the patient first. I was on a Facebook group, and I almost never comment on stuff, because behind the screen, people really allow their egos to take over, and that's when they have the confidence to say whatever they want. I made a comment in it was a dental implant group, and it was general dentists. I don't know how many other hygienists are in there, but there was a thread, and there was one dentist who she was posting panoramic films of patients who have had some jacked up dentistry. I mean, just horrible. And I had made a comment, and I said, it's the responsibility. We have to be honest with our patients. So basically, this particular dentist didn't tell the patients that, it was incorrect what the dentist did to you, or, you were being treated by a dentist that was practicing outside of their skill. All because they wanted to protect the reputation of the dentist. But what about the patient? The patient has the right to know if of malpractice. Why are we protecting the reputation of dentists who are practicing outside of their skills and putting people's lives at risk? Because the research will tell you how serious implantitis is, and like I said, the oral systemic link is something that I honor. But anyways, a dentist did not like what I said, so he had responded to me, and he attacked me because I was a hygienist. And basically I told him, I said, well, I'm sorry that you feel that way, but my responsibility is to the patient. And I will always be honest with my patients, because I put their lives and their well-beings first. Mm-hmm. So
did he respond back to that?
No, he didn't.
It's interesting, because when I have taught, and I've taught ethics, I've talked about that with dentistry. We are in a very small community, and I've told them, if you've seen anything that is a concern, you never want to state, this dentist did it wrong. This is what I'm telling them as an educator. However, you need to let the patient know this is an area of concern. You have the right to go back to the dentist, because there's an area here that we can't treat. Mm-hmm. You need to go back and have them take a look at that. Mm-hmm. Because I've been I told them that there was a situation. This is an ethical dilemma if you're in an RDH, where I was treating a patient. I was in a working interview for about a week and a half to see if it was going to work out. And the lady came in, and I was coming into an office where no perio charts were being done. Ever.
There's a lot of places.
Okay.
There's a lot of offices that currently don't do that.
I am like probing these people, and it's just drop. So this is a particular, and I'm telling them about the perio, and they're like, oh,
nobody's ever told me that before.
Exactly. So this patient came in, she had a window of dehiscence on her mandibular anterior. Mm-hmm. And I said to the doctor at that time, I said, before he came in, I set the patient up to be referred to perio. Mm-hmm. Okay? Mm-hmm. And I came in, and after I came in, told the patient that and everything, then went and got the doctor. The doctor came back. Oh, he was like, oh, it's nothing. It's nothing. Now, listeners, you may not remember what a window of dehiscence is. What it is simply a window. You have your gingiva, you have the attached gingiva, you have the free gingiva. So right in the attached gingiva area, and this is below it's right in the alveolar process. There's a little window where there's gingiva above, below, and to the left and the right, and you can see bone. That is not normal. Mm-hmm. And so the patient looked at me like I was crazy after I took the time to show her with the mirror. And when he left, I had to explain to her, I know that the doctor said, not to worry about it. But if you are still concerned with this area and it's been here for some time, please get in a second opinion. Mm-hmm. Mm-hmm. If you don't feel comfortable.
Here's why.
I couldn't say, hey, this is not right.
No, yes, you can. And here's why you can. A couple of months ago, I was in a CE. And the hygienist who was speaking was talking about how there was a situation where there was a hygienist who was working in a practice who was not doing perio charting. Well, you know what? That patient left, went to another practice, was told that they had advanced periodontal disease. What do you think happened? Malpractice, right?
Yes.
So they sued the dentist. What do you think the dentist did? The dentist turned around and sued the dental hygienist.
Yes,
okay?
I've heard of that. Yep.
So if you remember anything from today, remember that story. And when you're going back and forth deciding on whether or not you need to be honest to this patient or not, remember that story. Mm-hmm. You have your own butt to cover. Mm-hmm. We have our license to protect. We have our scope of practice to protect. I was working with a dentist who wasn't in the office when scaling and root planings were being scheduled and wanted me to be administering local anesthesia. Well, guess what? We can't do that in D.C. Mm-hmm. So I'm not going to jeopardize my license for your flexibility or to convenience you. It's not happening.
Absolutely.
We have to remember we work under the supervision, but we are our own providers. We're our own practitioners. We have our own scope of practice that we're doing here. Mm-hmm. And we need to take responsibility not only for the patient, right? Because it's always the patient first, but for your own license and all the hard work that you put into dental hygiene school. What we were taught in dental hygiene school matters. And I was lucky enough. I don't know if I would be the hygienist that I am today if I didn't graduate from Phone School of Dental Hygiene, the best dental hygiene school in the entire world, the first dental hygiene school in the entire world. But that's what my educators instilled in us.
Yeah.
The way that I
do empower you. The
way that I think is I learned through osmosis, and I've been lucky enough to have been mentored by just the greatest. Mm-hmm. And so that's why I am who I am. Mm-hmm. And that's why I've been fired from practices because of my taking responsibility for my role and standing my ground and standing up for myself. I don't care. Mm-hmm. I think that the hierarchy in dentistry is upside down. In most practices, it's the dentist, office manager, front desk, dental assistants, and then the hygienist, when really it should be the dentist, hygienist, office manager. There's situations where I've been in where dental assistants were trying to tell me what to do. Now, no disrespect to dental assistants, but that's just the perception that some dental professionals have of us. They truly do think that we are teeth scrapers. Mm-hmm. And there's only a handful of clinicians that are like me and you and everybody that we're associated with. And it's the hygienists who do not, like I said, people will treat you and behave in a way in which you allow them to. Mm-hmm. My little sister, Nicole Haley, who is an incredible clinician out in San Diego, was telling me a story how, a dental assistant was trying to, control her. And my sister just turned around to her and said, listen, I'm the licensed professional here. I'm the practitioner here. I will do it when I said I would do it, like I told you to do it. You know what I mean? I don't know why we are not being respected as practitioners. We are on the same level as the dentist, and we're not being treated that way. And as I'm talking to you, it's just like, my mind runs at like 100 miles per minute. And sometimes it's hard for me. And when I get excited, it's hard for me to communicate that, because people aren't inside my head. And sometimes I really wish that they could be, because I am who I am because of what I've gone through. I also am who I am because of my educators. And also I came out of hygiene school. I hit the ground running. The first practice that I ever worked in was unique. It was a periodontal office. He had 4 hygienists, no front desk, 1 assistant. We did everything. It was truly a unique setting. So as soon as I came out of hygiene school, I was put in all of these out of the box practices. And then when I was a dental assistant, I started dental assistant at the age of 14. I worked for the same dentist all the way through high school, all the way through college. I was his quote unquote right-hand man. And he was, I didn't realize it at the time, but he was practicing multidisciplinary. He was practicing intra-professional. I was 16 years old, and I was a surgical assistant to an oral surgeon, a periodontist, a general dentist, and an endodontist, all in the same practice. So right off the bat, I was put in these special situations. My very first dental hygienist mentor, Michelle Comedy, back in, this is Boston, she was exceptional. And, you know, sometimes you go into private practice and there's that whole thing with like, office drama and office jealousy where, you know, hygienists are jealous because there's another hygienist who produces more or whatever. Well, I saw this woman and I wanted to be just like her. And I told her I wanted to be just like her. And she took me under her wing. And she was the lead dental hygienist. It was 2 different practices. And she worked as a co-therapist with the dentist. And she also was involved in a lot of the decision making that went on in the offices. So I am who I am because I learned through osmosis. And
now, what do you mean by dental hygienists are on the same level as a dentist? You've got to explain
because
that.
We're practitioners.
Okay. So we're both providing services.
We're providers.
Yes.
A dentist is a provider. A hygienist is a provider. We just provide different services.
Absolutely.
We have our own schedule. I think it's hilarious.
What do you think is preventing us from working in collaboratively? Because we should all, if just like the parts of the body, my foot does something different, my hand does something different, my elbow.
The board of dentistry. The board of dentistry is preventing us from working collaboratively. I think it's an ego thing. You know, dentists in some areas they don't allow us to expand our scope of practice because, I mean, everybody read the book Teeth. I'll just leave it at that. Everybody read the book Teeth. At the end of the day, I will argue anybody who says dentistry is a business. It's not a business. We made it into a business. It's healthcare. It's people's lives. But that's why I feel some states are really struggling with expanding the scope of practice is because dentists are worried about stealing business, money.
Do you think it'll change in our lifetime?
Yes. As long as I'm in it. It's already changing. That's my mission.
That's true.
It
has.
Dental hygienists will be able to practice individualized care, especially with all of the advancements in technology. I mean, it's just, you know, the more that we are doing, or the more that hygienists are. I mean, look at when I was at your Think Beyond the Prophy. Probing the Death of Excellence event, I can't tell you how many hygienists came up to me during the break to ask me, you know, they wanted me to say something to them to empower them, right? Because they were in situations where they were only giving 45 minutes for the patient, double booked, this, that, and the other. But I can probably talk to you until you're blue in the face. But it's because it's fearful to stick up for yourself. But once you do it, and the results, they can either be positive or negative, but it will be life changing because finally you made that step to stick up for yourself. And the first time you do, you'll never stop. And that's the way it's been for me. But we have to, things are changing, and they will, but I feel like we are still outnumbered by the teeth scrapers or by the clinicians who are just going working the 9 to 5 and not standing up for themselves. But with everything that we're doing, they want us to do, head, neck, and oral cancer screenings. They want us to do full perio charting. They want us to do, Canberra. They want us to do all these different things, but yet they're not extending our time.
Yeah.
You cannot do that all in 60 minutes.
Absolutely.
I was working for a periodontist where we were going head to head. She expected an FMX, full perio charting, and a glass shine on the, in the patient's dentition at the end of the appointment. And I told her, the more you pack on to my schedule, the less time I spend in the patient's mouth, because something gets sacrificed. And unfortunately, that's the therapeutic care when I'm in the patient's mouth, because you're giving me an hour. So it's funny. I was because I do temp part-time, and I was in an office the other day, and I was scheduling the patient for their next visit, and the office gives 60-minute appointments, but when I put the FMX in, it added 15 minutes to the schedule. Right? But then we go back in and we have to decrease it to that 60-minute because that's the time that we're allotted. So the more you give me to do, the less time. I don't care if I left a piece of plaque in the patient's mouth. Like, what you see is a result of what I'm capable of doing and the time that you're allowing me to do it. If you want me to do better, you need to give me the time to do it. And when the patient, sometimes they ask me, I had a patient ask me, how come we don't get perio charting every time? I'm like, because I only have an hour today, and today we had to do an FMX, and if that is a concern, I suggest that you speak to the doctor about it. Or I do oral cancer screenings or head and neck once a year. Patients ask me, how come once a year? Well, first of all, that is the guideline, right, once a year. But I explained to the patient, well, remember when you came last time we took an FMX, and the time before that we did perio charting? I can't do all of that in one visit. So unfortunately, I have to sacrifice. It's not my choice.
And you're not doing the quick oral head and neck exam. You're doing the all the way up the neck, on the forehead, occipital lymph nodes, all of that.
And I enjoy doing that. And I tell patients, listen, I wish I could just sit here and do this all day to you.
So what made you and Melissa, what made you both grab on this chance to work together with RDH Innovations? Like, what answer is RDH Innovations given to helping hygienists reach that next level?
So how Melissa and I came to this was because we were actually both in a research course at ADHA because we were trying to learn more about the protocols and the standard of care, because right now research will tell you that there is no protocol or standard of care for dental implants, and that's because nobody is being brave enough to say, you know what, well, CBCT scanning is the standard of care because this, that, and the other. But anyways, in the beginning of the course, the instructors had us get up and say a little bit about ourselves. So when Melissa got up, she talked about how she was here because she's trying to find more education on implant dentistry, and she talked about how she was practicing for a prosthodontist and all of that. And then I got up and I said, well, I am an implant care practitioner in oral surgery. And then we kind of turned and just looked at each other, and I was like, well, I have to talk to you. And she's like, well, I want to talk to you. That year was when we were doing our, we were giving our first presentation.
Oh, yes. Yes. We gave our first presentations at ADHA.
Yes, yes. The focus groups. And so I was so nervous about that I left the class early and I didn't get a chance to exchange information with Melissa. But Melissa had given her contact information to one of my colleagues who I was taking the course with. And then so we kind of left it at that. And then I was sitting in the plenary event where they were doing the award ceremony, and they announced the winner for the Master Clinicians Award. And Melissa walked across the stage, and I was like, okay. I was like, that's right. Here's a sign. I need to get in contact with her. So Melissa was very she was motivated. She definitely was the one to spark. You know, she sent out the email to me and a few other people, and it was like, you know, we need to come together. And I was the only one that really responded to her. And I think that was because we were meant to be. And what's unique about us is that the way she practices is different from the way I practice. And that's because implant dentistry is complicated. And so we're able to come together and really give, I mean, it's the full package because, you know, two heads are better than one. We're better together.
So what you guys have built is pretty awesome. You did a ADHA webinar, and then in February, you're going to be presenting a revolutionary program. So tell us like how that works, because I mean, I'm sure the listeners are like, okay, Shavonne has now got me all fired up, ready to go, and so empowered, and I'm interested in doing more. So that like, why did you create the program that you did with Melissa? Like, what answer is this program given to clinical hygiene and advancing it?
Well, it's more than just giving an answer to clinical hygiene and advancing it. It's one way to help a problem, which is the rise of peri-implantitis. So that's the first purpose what RDH Innovations is here to serve. And you can advance your clinical practice in any area of specialty. There's the hygienist. Is it Sarah Lawrence? I don't want to mess up her last name, but I can't think straight right now. But she's doing the whole pediatric dental hygienist.
Oh, yes.
And it's just
Sarah Lawrence.
Yes. And it's just advocating for specialty because there's a lot of information and we cannot, and it's expertise. You have to have expertise and you can't be an expert at everything. So dental hygiene has come a long way. We have hygienists who work alongside prosthodontists, periodontists, pediatric dentists. There's even situations where hygienists are working with orthodontists. So because dental implants are the standard of care for replacing missing teeth, and when it comes to complex cases, most of the time these are seen by oral surgeons. We need dental hygienists to work alongside oral surgeons. Another thing is the oral surgeon will place the implant. And I was having this conversation with Dr. Kazemi the other day. You know, the oral surgeon places the implant, right? And then they don't see the patient until 10 years when the implant is failing. And then who's responsible for that? The oral surgeon. So why can't the oral surgeon work collaboratively with a dental hygienist to maintain his dental implant cases? You know, I don't know why people just can't acknowledge when there is a situation where it's outside your clinical skill and you can't meet the patient's need. It's just not fair to the patient. Right. So the Implant Care Practitioner is the answer for those dental hygienists who are in a situation where they're giving 45 minutes appointment, or where they don't have the equipment, or they don't have the knowledge. All right. So it's the opportunity for the dental hygienist to work intra-professionally as a referral source. Okay. Mr. Patient, you've got this tooth. I don't know, there's implantitis. Unfortunately, I don't have the proper equipment to reach the need, but I'm going to refer you to my colleague, the Implant Care Practitioner at such and such's office. And then, as I mentioned, peri-implantitis is on the rise. A lot of that has to do with, like I said, it's multifactorial, but one thing is inexperience of the clinician.
Right. And I tell you, for me, going to just less than an hour of a course that you did for our students.
Yes, that was less than an hour.
It was less
like
than an hour.
30 minutes.
My mind was blown, and I started my career as a dental assistant. So, they did endo, they did surgery. I would be assisting with that. And then I go on to be a hygienist, and I still didn't know. I won't even say a third, whatever is half of a third of what you were sharing. And so this event that you're putting on with Melissa Nicole Fortune, who I do want to mention that she was attending the Think Beyond the Prophy event from Vermont. She came all the way from Vermont here to Maryland to come to this event. And I'm so glad she did because she connected with you.
Mm-hmm.
And
now she's on our team.
Yep. Nicole, Jill Grassmick from DC, who does laser certification. You guys are going to be putting on a program that are going to help hygienists become implant care practitioners.
You did ask me, how did it get to that and why? Sorry. Thank you for redirecting me. Okay, so I've been like a wild animal. I mentioned earlier about, learning the surgical, restorative, and laboratory aspects of implant dentistry. So I was a wild animal, and I was just attending all these courses. In Chicago, I attended the multidisciplinary approach to peri-implantitis, where there were internationally, the
recognized,
experts, I mean, I can't even get the words out because until this day, I'm still mesmerized by what I experienced. Mm-hmm. But I did go up to the program organizers and I said, well, one thing was the experts kept talking about maintenance and how the dental implants must be cleaned, because that's all we do, right, is clean. But the dental implants must be cleaned by the dental hygienist. Mm-hmm. Like the patient has to be able to clean them and the dental hygienist has to be able to clean them. Well, I went up to the program organizers and I said, I appreciate you for acknowledging dental hygienists, but we're here to do more than just clean. And I said, another thing is I don't understand how you have these multidisciplinary approaches, but there's no component, there's no area for the dental hygienist to come and talk to each other and discuss what we think the standard of care should be. So, I made connections when I was in Chicago, and I met the program organizers at Geislich, and they did mention that they had thoughts about putting on a program for dental hygienists. So finally, I actually kind of like learned this from you, which was just be bold and just go up and just ask, because the worst thing that anybody can say is no. Mm-hmm. So finally, I just asked them, and I said, listen, this is what we need. This is what I'm capable of doing. Will you allow me this platform? And somebody said yes.
That's it.
Somebody said yes. So we've got our program going on February 9th. And like I said, it's patients first. We want to educate the dental hygiene profession so that the population with implant dentistry can have competent care.
Yep. And then what I'll do is I'll put the link in the show notes so that our listeners will be able to go, hopefully, and tell them. And if you've listened to this and you go, make sure you let Shavonne know that you heard it from here. Now I have two more questions. These are my last two questions for you. Mm-hmm. What was the last book you read? 30 seconds or less.
You want me to answer the question in 30 seconds or less?
Yep.
Okay. Oh my God, I'm reading 3 books at a time right now. That's hard to answer.
What was the
Think and Grow Rich.
Okay. All right. Your next question is, what was the best career advice you've ever been given?
If you don't believe in yourself, believe in me because I believe in you. By Jill Grassmick.
Yep,
How you doing, boo-boo?
Jill is amazing. Yes. Jill is amazing. Yes. All right. Well, you know what? I am so thankful for you being on here, sharing your expertise. I love your passion. And in fact, listeners, we will be putting on a workshop together where she's going to use her expertise in implants, my experience as an educator, and we're going to educate
your expertise as an educator.
My expertise as an educator, and we're going to educate those in academia to teach their students about what Shavonne and Melissa have learned in their careers, because they are experts in implants and our students need it. And so I am psyched. All this is going to be released by the time you hear this. It's going to be on and popping.
And I think it's important for listeners to know that if you cannot make it to Arizona, which I think it is worthwhile because there will be speakers there from across the world, and it's worth sitting in this audience and listening to what is going to be said. But you'll have many other opportunities to come catch us, and one of them will be through Think Beyond the Prophy.
Yep. Yep. Can't wait. And check out their Facebook page.
Yes, Dental Implants Uncovered study group. We only allow dental hygienists. If you are a dentist or anything else, you will get declined.
All right. Well, thanks for being on the show, Shavonne. I really appreciate it. Thank you for sharing your passion. And I can't wait to continue this conversation further.
Without the martini.
Yeah. All right. Thank you.